Welcome to everyone who's joining us. We'll get started here in about a minute.
Good evening, class. I see you guys logged in. Got the students from Ohio Media School watching the broadcast tonight.
Oh, great.
We are live on Facebook.
All right. Welcome, everyone, to the COVID-19 communityresources.com town hall meeting, powered by the Center for Closing the Health Gap. We've missed you all. It's so great to be back. Tonight, we're going to talk about where we are 2 years later with COVID. We're also going to talk about what the heck is happening with this new thing, monkeypox. What is that anyway? So we have a lot of good information. Your moderators today will be superstar Tropikana from The Wiz, and I'm Vice Mayor Jan Michelle Lemon-Kearney. First, of course, we have to thank our tech team because none of this would be possible without their work. John Reichel and Lauren Harden. We also want to remind you that we are taping this session so that we can repost it for those who can't be here tonight. Now, if you're on Zoom or Facebook, feel free to go right ahead and start entering your questions in the Q&A. On Facebook, you enter them in the chat and they will be transferred to us. So we are going to get to your questions as soon as we can. First, let me introduce our wonderful, wonderful panelists who are going to fill us in on what is going on. We have Dr. Edje, and she is UC Health's Associate Dean of Graduate Medical Education and a Professor of Medical Education and Family and Community Medicine. We also have Grant Mussman. He is our Health Commissioner for the Cincinnati. And we have Tiffany Mattingly, and she is Vice President of Clinical Strategies of the Health Collaborative. So let's go to each panelist to make your intro remarks. Let's start with Dr. Edje. Welcome.
Hi there. I'm just grateful that you're still having these. I think it's still important to have these conversations in places folks can come for information. I come to this from several different perspectives. I am in the Moderna trial. I started in that in August of 2020. And so I was just really grateful when the vaccine took off and showed that it was safe and effective. I also have the privilege of being a family physician practicing here in town. And so have had an opportunity to speak to patients about getting the vaccine and the importance of prevention. And I've also unfortunately had several family members who passed on from COVID before the vaccine was out. So I do understand some of the perspectives that people will be bringing to the table today. So thank you for having me. Looking forward to this discussion.
Thank you so much. Okay, Dr. Grant Mussman.
Hi, yeah, thank you for having me. I'm Grant Mussman. I am the interim commissioner at the Cincinnati Health Department. Really appreciate the opportunity to get out in front of the community and to talk about questions with ongoing health problems.
All right, thank you so much. All right, Ms. Tiffany Mattingly.
Hi, everyone. Thank you for having me this evening. I am very honored to be here. I serve as the Vice President of Clinical Strategies for the Health Collaborative. And to provide a little bit of background on the Health Collaborative, we are a supportive, neutral convening organization. We bring together those who provide healthcare, pay for healthcare, and receive healthcare to work on common practices, best practices, common challenges where we can come together and learn from one another, really for the good of the community. And during the COVID-19 pandemic, we did a lot of stakeholder convening and bringing folks together from public health, from the schools, from higher education, the hospitals, skilled nursing facilities, all sorts of folks coming together to have these conversations about how we can help keep our communities safe, where to get testing and vaccines. And through that, we did stand up the Test and Protect Cincy website that you may hear me reference throughout this evening as a great resource to find information.
All right, thank you so much. All right, Tropikana.
All right, you guys, it's your turn to ask questions. If you're on Zoom or you're joining us by Facebook, you're more than welcome to please enter your questions and your comments. We'd love to know your name so that we can address you. It's a personal family thing. So please make sure to share your name so that we can address you personally. And it's okay to be anonymous if you don't want to share your name and you just want to ask a question. Our first question goes to Ms. Mattingly. Let's start with COVID. How are we doing across the country and how are we doing here in Hamilton County?
Well, actually, things are starting to look just a little bit better, which is great because that's just in time for school to be back in session. So the cases have really plateaued, if not started to show just a little sign of decrease nationally and within our community. I'm really excited today that Hamilton County was downgraded from high to medium community level today, which means that the transmission and the impact on the hospitals is a little less than what we've seen the past couple of weeks.
That's good.
Yeah.
Is it because more people have gotten vaccinated? Are we at that herd immunity level? Where are we with that?
It's such a difficult question to answer these days. I mean, what we see is that we see the cases that are being captured through PCR testing. And so we don't see those cases with home testing. So we don't know if more people have moved to home testing. What we do see that our hospitalizations are fairly stabilized, if not decreased a little bit as well. So that's a positive sign that the transmission within the community is starting to decrease a little bit. So it could be the herd immunity. It could be maybe we have a few more folks vaccinated, or maybe that high alert really inspired people to put their masks back on and do some social distancing for a little while. So we know the formula that works, and hopefully that's part of what helped us get to this place we are, kind of on the downward hill.
That is such good news. I mean, we've been waiting to hear that for quite some time. I was going to ask Dr. Edje and Ms. Mattingly, you mentioned the masking. Do we still need to mask up everywhere? I noticed that it's kind of touch and go. I go to some events and everybody's wearing a mask. I go to others, nobody's wearing it. So Dr. Edje, what's your take on that?
Yeah, so we are in UC Health definitely still masking because it's a healthcare facility. And I'm still recommending that people mask when they are in an environment where, it's closed quarters, there's poor ventilation, et cetera. The issue is if people feel comfortable wearing a mask anyway, just to make sure that we're not making that a stigma for them to be wearing them. Sometimes people will be more comfortable with it. Also, if there's been, a risk of exposure, definitely. And certainly if there has been a period of time where you've been treated, you've tested negative, and you're coming out of that isolation, you still want to definitely be wearing a high quality mask, either a surgical mask or an N95.
Okay, great. I see questions are already starting to come in. And so this one is from Paul Nadel. And so Dr. Mussman, we're going to give you this one. So Paul says, can you please explain long-term COVID? I'm still out of work due to brain fog, memory loss, migraines, and blood clots. And he also wants to know, what should we take for those issues?
So, wow.
That's a great
Yeah. Yeah, that is a really complicated issue. I think there's a lot we still don't understand about what long COVID is. And COVID is a nasty virus. We hear a lot about how some people get over it relatively quickly or don't have many symptoms. Some people get quite sick. A few people need to be hospitalized, and you have people who experience this long lingering illness that can go on for months and months and months and be very debilitating. There are experts or folks who are at least trying to learn as much as they can about long COVID. It seems like it's a constellation of different symptoms and impacts. But I can't claim to have a great understanding of why some people get long COVID and why some people don't. And unfortunately, I don't have a great answer about what you do if you do have it. But there are people who are gaining expertise in it and who are treating it and have patients with it and are learning some things. And so I'd encourage you to reach out to your doctor. And from there may be some referral resources. If you don't have a primary care doctor, there are federally qualified health centers in town. We operate a large one within the city of Cincinnati Health Department, and we are accepting new patients. So if you don't have a healthcare provider who's helping you with these things, then that would be a good place. That would either way, it's a good place to start with getting hooked up with a healthcare provider who can deal with these issues, because it can be a lot of overlapping problems.
Now, Dr. Mussman, with what you just said, with COVID, long-term COVID being something that we're still living and grappling with and learning about, is COVID just now a fact of life that we're going to have to live with? Is that just a new thing that we'll be experiencing similar to the flu? Should we just get used to life with COVID?
I think so. I don't know. I know. I don't know that anybody really knows the answer there. It could go away as mysteriously as it came, but it sure doesn't seem to be going anywhere. I'm skeptical that anything we did really helped with this, with the level starting to go down now. I don't think anybody really knows at this point if it's because we did a lot of vaccines or if everyone just got sick, or viruses just do this in pandemics. And we're very fortunate, or maybe it's not fortunate, maybe this is just what viruses do after a while, but that the morbidity, the impact of COVID is a lot less, but still much worse than the flu, which the flu has, 50 to 80,000 deaths every year in the United States. And COVID, at least last time I looked, was on pace to still be higher than that for the year. So, but not nearly as bad as it was in terms of that a year or so ago.
Yeah, at UC Health, it's been designated an endemic situation, and something that essentially means that we will be learning to live with it. And we've, switched from, if you had an exposure, you don't have to isolate at all. Just need to go ahead and be protected. So yes, we've moved into that phase of now this has sort of changed scenarios. And it's going to be something that we really are learning to live with, and people will need to take time off, when they get it, and we'll need to just make sure they're testing. We've moved away from having PCR testing to return to work after 5 days off. We're relying on home tests as long as there's, some evidence of that home test that's uploaded. So.
Okay.
Dr. Edje, if we no longer have to isolate when we have COVID, how do
you can't? Yes, no, you still have to isolate when you have COVID, but at the 5th day, when you're going ahead and trying to see if you can re-enter, into your normal spaces, your normal work, we used to require a PCR test to make sure you were negative. Right now, they've gone to relying on a home test being negative to be able to re-enter.
Okay, thank you.
And then we still do need to mask for that 5 days after.
Do you suggest that we just still wear masks as we're sending our kids to school? Should they just still have their mask on as an extra level of protection?
I'm going to let someone else answer that. I'm a mask fan, and I've got a little bit of bias, so.
So, in public health, I want to make sure I'm walking the walk. If we're really going to say that we're following the CDC recommendations, and the CDC has assembled this marker they call the community level, which is sort of rubbing together numbers about what's the transmission rate, how often are folks winding up in the hospital, and how often are folks winding up in the ICU. And as Vice Mayor Kearney just pointed out, we've gone down, or Hamilton County has decreased in our community level to medium. And the CDC recommendation for that is more focused on folks who may be at higher risk or immunocompromised wearing masks, versus when it was high, the CDC recommends wearing masks indoors. My kids definitely wore masks because the first few days of school, because that was the CDC recommendation. And I think we'll probably continue to follow that recommendation.
Wow. Let me jump back to Paul Nadel's question about brain fog and other issues. Someone else wrote in for the Q&A that they had COVID a year ago and they still are having these symptoms. And then someone said that they were, and I don't know what this is, it said that they are giving me ADHS medication.
Maybe they meant ADHD because that S is close to that. Is
Okay.
ADHS a
Yeah,
medicine,
possibly.
doctors?
And anyone can jump in. Okay, so maybe it's ADHD then. Okay.
I think the key thing with long COVID is it can be a lot of overlapping things and it can manifest a lot of different ways, at least to my understanding. I don't think there's going to be one answer, one cure, or one approach. I think it's going to be a more holistic approach that deals with what people are experiencing. Again, I'm not an expert, and I would encourage you to reach out and start with your, primary care physician who can get you steered in the right direction, and do a thorough exam and all that stuff that I can't do over the internet.
And I know you guys aren't giving medical advice, but let me just throw this out because I had COVID 2 years ago, kind of at the beginning of it, and I took zinc and vitamin D and it helped a lot. Is that what some folks are recommending, or is it just my imagination? Because every time a friend of mine gets COVID, I always go, get some zinc, get some zinc.
I'm not aware of any evidence basis for that. No.
Really? Oh, no.
But there are things we know that do help, right? So Paxlovid, if you've got it in the first 5 days of your symptoms, things like that. So there are things that we know that we can use to help.
And actually, the Test and Protect Cincy website, we have a test to treat page. So when you go to that website, you can find where to get tested, where to find low cost or no cost testing. But we also have a tab specific to the Test to Treat program. So what we realized is the ASPR website, or the website where the Test to Treat locations are, is really difficult to navigate. And so we pulled that information over to make it more user-friendly for our community. So you can get to that site. We have it sorted by county, and you can see where you can go receive the Paxlovid or receive a test and then Paxlovid at those specific sites.
Vice Mayor Kearney, we have another question, and it's a good one. Dr. Edje, maybe you can address this. Is there any new information that the professionals online can share that can help skeptical individuals better decide if they should or should not take the vaccine?
So definitely getting the vaccine. They have numbers that they show of folks who've got admitted versus folks who have died, comparing those who've been vaccinated and those who have not. And there are significant differences, thousands of patient differences from the standpoint of the number of people who get admitted who were vaccinated and the number of people who get admitted who were not vaccinated. So the numbers, I really think, tell the story. So if getting admitted to the hospital is something that's going to take time out of your life, it's going to disrupt your household, your job, etc., it's absolutely something that you do want to go ahead and do. And I recommend you get the full vaccine plus the booster if you are eligible for that. So
Are we still seeing a lot of admissions of people who are not vaccinated into the hospital that have received COVID?
We are. It's gone down over time, clearly, but definitely they are the preponderance of folks who are admitted to the hospital with COVID are non-vaccinated.
And what we're learning now with these new subvariants from Omicron is that the immunity wanes or lessens much quicker. So somebody who had COVID a couple of months ago and maybe caught the BA.4 subvariant may only have an immunity of 28 days. And now we know there's this BA.4.6 subvariant that's starting to circulate. And so that the vaccine provides longevity far beyond what we're now seeing with these subvariant, with the immunity with the subvariants.
And Moderna just actually put out, a notice to the FDA or sent their information in requesting that a bivalent, which means 2 strains, BA.4 and BA.5, in their vaccine. So they've got a new booster that's coming out that should combat both of those 2 strains. And that was just yesterday. So hopefully we're hoping by Labor Day that anyone over age 12 would be able to have access to some of the additional protections there.
Yeah, I always like to say that the vaccine's not bulletproof. I mean,
Right.
It may not prevent you from catching COVID, but it's very likely to prevent you from severe illness, hospitalization, or death.
Well, that's important. Yeah, absolutely. Can you all refresh us on what ages should get what vaccine, meaning, everybody should get, I guess, the first 2 shots, or if it's Johnson & Johnson, just 1 shot, and then there's a booster and then a second booster. Where are we with that? What's the protocol there?
So there's a lot of different vaccine combinations, but basically, so most adults would be at this point recommended to get the primary series plus an additional booster shot. Adults over I'm not even sure it's most adults, adults over 50, if I recall correctly, and immunocompromised are advised to get a second booster shot. And the timing, I'd have to refresh my memory on the timing there. And then older children also are recommended for a booster shot. And the 0 to 4 population, I'm sorry, I don't think they're recommended for a booster shot at this time.
Okay, but they do get the first shot, so that's important. And how's the vaccination rate now? Are we overcoming a lot of this fear and getting folks vaccinated who were reluctant before?
So 2/3 of Ohioans over age 5 have gotten at least 1 of their vaccines.
Oh, that's great. Yeah. Oh, that's
So
fantastic.
Here locally, our vaccine rate's been holding pretty steady around 60%. And now that's about a 14-county region, because we like to look at Indiana and Kentucky and Southwest Ohio, because we know people travel around our tri-state area. And we've really been at that 60% mark for a really long time, at least probably 4 months now. But we do know that every day vaccines are being given, and every vaccine counts to help keep one more person safe, and then all of the people around them safe as well. So, but it hasn't moved a lot. I do know that the Hamilton County, it sounds like, has had some pretty good success with their infant and child vaccines. So that's great. And they've seen a little bit of a boost as school is coming back into session.
That's wonderful. Well, Tropikana, should we start talking about monkeypox now?
Please,
That's a
I
whole-
need to know.
Yeah. Okay, so let's just start. Somebody, what is monkeypox? Where did it come from? What's going on?
Dr. Edje, you want to do this one?
Oh, sure. So monkeypox is an orthopox virus, which basically means it's in the same family as smallpox, which I hate the fact that that word is even coming up because we sort of eradicated smallpox. But it's helpful to know that information because some of the antivirals that help with smallpox can help with it. It is also something that's transmitted from animals. It's endemic in Africa, in certain parts of Africa. It has a narrower population that it tends to affect. In fact, 99% of individuals who are affected are men, and 94% of those men are men who have sex with men. And that's a categorization that we use in medicine. That is not the only subset of individuals who get affected by it. And it can also be transmitted from mothers to infants as well through the placenta. So,
okay, so.
If I could,
Yeah, no, Dr. Mussman, go right ahead.
Yeah, and if just to build on what Dr. Edje said too, that's the population that's overrepresented right now, but it's not a virus that's spread through sexual contact. It's just
Correct.
spread through regular contact.
Absolutely.
And that's just the circle that it made its way into first. But there's no reason why it can't spread into other circles. A lot of our messaging right now is focused on that population, just, for equity reasons. They're the
Absolutely.
folks who are bearing the brunt of this right now. But at some point, unless we contain it, and I hope we can, but it could easily spread outside of to any number of places.
I'm so glad that you addressed that. I'm sorry, I didn't mean to interrupt you.
Tropikana, go right ahead.
Because this has been a topic of conversation in the group chats and social media. And, I always need to have clarity so I can tell people the truth. You guys help me become certified as a doctor every time we do these town halls. And the first question everyone said is that it is affecting that community and it is not affecting other people. So thank you for clarifying that it's there first, but it can spread further. The question is, should we be concerned as we were when COVID first broke out? Is this going to be something that could be a pandemic as well?
So I'll answer from the standpoint of the fact that it is affecting disproportionately those who are minority individuals, just as COVID had that same predilection. So absolutely, I think we need to keep an eye on this. And again, viruses are viruses. They will spread and they can spread. So we need to, I think, jump ahead and hopefully be as proactive as possible.
So is it spread through skin contact? Is that it? Like if there's an open pox and someone else has an open wound, that's how it spreads?
We've heard that they
Yeah.
spread through sharing bed sheets and
It
clothing.
can. So it can. How much it's spread through that is still an open question. The majority of the spread appears to be direct skin contact. But to get back to the question that Tropikana was asking about, how much should we be, is this like the early COVID? And I think there's a couple differences here. One is, the symptom that you get has a visible sign that is identifiable. COVID, the common cold, like, gosh, how do you sort that out from allergies and every other virus that's out there? And it's not nearly as infectious. We don't have the case numbers that, COVID took some time to ramp up, but some of that may just have been our testing that lagged behind. And then I think a final point is I mentioned earlier that COVID is still quite deadly, but in the United States, we've had no fatalities from monkeypox. There have been in previous outbreaks, and I think there have been in this I'm not sure about that actually. I'm a little fuzzy on if that was this outbreak or a previous one outside of the United States. So much less deadly than COVID. And there are some easier steps to take. It's primarily through touch rather than in the
air. It's not in the air.
in the ether.
Well, it can.
Well,
it
so it
in
can
the
be.
air.
Yes,
Okay, yeah.
it can be, but that's not the primary mode of transmission.
Is there an incubation period, like prior to the symptoms showing that you could have monkeypox and carry it and transmit it to somebody else? Or is it only transmissible when you actually see a monkeypox or a sore, for lack of better words?
So you're transmissible typically between a week and 3 weeks, and from the onset of symptoms all the way to the last lesion is scabbed up.
Wow.
So, so you have to see the open pox in order to be contagious, right? I mean,
So I think there's some so I'm going to qualify my statement. I'm not a virologist, and I'm not an expert. I think there is some period of time where the symptoms may be subtle, where you are shedding virus, particularly through mucous membrane contact. So like kissing is an example. But I don't know how long that is, or how prevalent that is.
Yeah, my understanding is, so if you've been exposed to monkeypox, right, you don't have to quarantine, but the minute that you do start to experience any symptoms, many times it starts with a fever, body aches, those types of symptoms that you do then at that point should quarantine and self-monitor for any type of rash. And then we do say if you identify that a rash does appear and you are seeking testing for monkeypox, that you call your primary care provider. And if you don't have a provider, that you can reach out to the local health department or any of the federally qualified centers to that can provide testing, but always inform those on the phone when you're making the appointment that that's what you're coming in for. And then they recommend that you cover the rash and wear a mask.
And I would even go further upstream and go with the vaccine too for high risk individuals. So we're really, again, trying to be proactive and not get to the point where people are having disease, but go ahead and proactively make sure that they get vaccinated. There are 2 vaccines that are out right now. One, which is a 2-shot series, and you get full immunity 2 weeks after the second shot. And then there's a single shot that's out. It's a little bit more reactogenic, meaning that your body will react a little bit more to it. And that doesn't get full immunity until about a month after.
Does
So
everybody go ahead?
No, go ahead, Rob.
Does everybody qualify for that vaccine? Is that something that we can just go and say, hey, I want to be vaccinated for the monkeypox?
So if you're exposed to monkeypox, so if you were in close contact with somebody who has monkeypox, we have vaccine and we will give it to you. If you are worried that you may be at high risk, we have a link on our website, and so does Hamilton County, where we will register you to get the vaccine. And then there are some questions, some of which are of a bit of a personal nature, that help us assess risk. And the highest risk folks then will get the vaccine. And the reason we're doing that, I don't like not only giving it to some people on some fairly arbitrary criteria, but it's it's not arbitrary, it's who's affected, but is that we have very small numbers of the vaccine at this point. But we have enough to keep going for some time for folks who are even medium high risk or high risk, or anyone who's been exposed.
Can you just give us like what does that mean? Medium to high risk, or high risk? Like who are they, or how do you know if you're high risk or not?
So the CDC has given us some guidance on who should be prioritized for vaccine. And they essentially have 4 tiers, and it goes from you're somebody whose job is to handle monkeypox virus in a research lab, to you've been exposed, or you were at a party and somebody there had it, but you don't know if you were there near them or not, all the way down. And that we've sort of stratified it into high, medium, high, and medium and low. And that'll change, I think, as the outbreak changes. Depend, if different groups are affected, or, what changes now. Number of sexual partners is important because there's a lot of skin contact. So if large numbers of sexual partners in the last few weeks, you could see that there's a lot of skin contact and a lot of potential for spreading a virus like this, versus, someone who, for example, is a member of the LGBTQ community but does not have a large number of sexual partners, is not really at any higher risk than someone else. So.
And Dr. Mussman, I know we've talked about this. You and I have talked about the amount or the numbers of vaccines that we have. And I know we're trying to get more from the CDC, but are we good for now? Do we have enough vaccines for people, for the medium to high risk folks who want them?
Yeah, we're good for now for these highest risk folks. In fact, we're exploring ways we might be able to expand that without running out, because we don't want to run out, because then folks who are exposed are going to be in trouble, and folks who are hesitant about the vaccine and are just coming around are not going to have an opportunity. So it's a bit of a balancing act, like how we can make it more available without just exhausting the supply.
Hey, Tropikana, I was just thinking, when COVID came out and people were just kind of having a fit about, this vaccine was new, and Dr. Edje explained it's not new. It's been in process for 20 years. But have you heard any outcry about the monkeypox vaccination?
Absolutely. Absolutely. We live in such a skeptical society, and everybody is an expert. Nothing has changed other than we're just a little bit further along in time. People still are afraid of getting vaccinated. They still think that there is we just got over COVID and now we got monkeypox. This is a hidden agenda. So I'm so happy that we're having this panel discussion to clarify those things. But people are afraid of being vaccinated, which is still crazy to me, as we all who went to public school had to get vaccinated to get through school. My question, I guess that I would ask next would be, when getting vaccinated for monkeypox, are there any side effects that people should be aware of so that we can counteract any myths that they will come up with later?
So the vaccine's pretty well tolerated. One difference between this vaccine and the COVID vaccine is this vaccine has full FDA approval and was approved in, like, I want to say 2019. It's been around for a while. I don't know who the mid-level manager was who convinced his boss that they should get it approved for smallpox and this random thing called monkeypox, but that guy is pretty high in my book right now, because it's actually FDA approved for monkeypox, which is very
Amazing.
Fortunate.
Yes.
So
here,
Dr. Edje, you were so great in explaining what the COVID vaccine is, like what's in it. Can you all explain what's in the monkeypox vaccine? And then my follow-up question to that is, are there people who shouldn't take it, like maybe pregnant women or people with certain illnesses?
I'm going to defer that question. I don't know the full ingredient list. I can't say that I've got that information in my head right now.
Okay. Well, does anyone know about, whether or not certain folks, as I said, like pregnant women, for example, should not take it or should take it?
Jynneos is it's a live virus vaccine. So sort of the same way that like the chicken pox vaccine is. It does not replicate in humans, but it is a live virus. So, one way of doing a vaccine is you make a virus sick or make it not work very well, and then you give it to people and it induces the proper immune response without actually getting them sick. The kind of side effects from it are mostly local reactions, but you can have things like headache, and muscle ache. But to my understanding and our experience with it is, and again, that's with subcutaneous injection, which we've switched to a smaller dose intradermally to multiply the amount of vaccine that we have. But mostly not seeing those kind of reactions like we did with the mRNA vaccines. There can be some more adverse reactions for folks with atopic dermatitis, so eczema, and some adults with HIV infection and some immunocompromise from that.
Now, I'm glad that you said that about eczema, because as a as a kid growing up with eczema and as an adult still struggling with eczema over the course of my life, it's been a 20-year thing. The one thing that people who I can speak for who have a dermatitis issue said is, oh, this is scary. The monkeypox thing, the last thing you want is to have an outbreak of eczema and it be confused as a monkeypox or something similar. You said that there may be a little, could you just kind of expound a little bit on how monkeypox could maybe affect people with dermatitis issues?
Yeah, actually, I have to apologize. I was looking at my notes and I misspoke because I wrote my notes badly, and they said people with HIV and dermatitis, eczema dermatitis are not or have not shown increased amounts. So that's my fault because I'm reading off of notes that I.
No, that's fine. Thank you for the clarity. I just got scared. I was about to go call my doctor right now.
There is in previous outbreaks, there's been some suggestion that folks with eczema do have, and this is not from the vaccine, but from monkeypox, and children under 8 have some increased severity. We don't know if that's because the outbreaks were in countries where malnourishment in children and immunocompromise was more common, or co-infection with something else, or maybe that was a different strain, or maybe that will be true this time. I don't think we really know.
So, I mean, and we're talking about monkeypox, but is it becoming some kind of epidemic now, or some kind of pandemic? Are the numbers going up or down, nationwide, worldwide, and then right here in Hamilton County?
They're still going up.
They're still going up? Okay.
They're still going up. Actually,
Tiffany, I'm sorry, I didn't mean to jump in. Yeah.
No, that's okay. I was actually trying to find my notes to go back to the pregnancy vaccination discussion, because I know that the CDC released some guidance for those who are pregnant and breastfeeding. And so I was trying to pull that, but since we don't have a solid answer, I do want to say that information is out on the CDC website for those who are pregnant and breastfeeding in regards to testing, treatment, and vaccination. So the Ohio Department of Health, super timely, so I thank them for this, that just sent out an email a couple of hours ago saying that they've launched a monkeypox dashboard. And so we had some idea of what was happening here locally, but it's now we can see what's happening across the entire state. We knew our state numbers, we can follow those on the CDC's website, but now we can see what's happening in pockets around the state and by county. And so we know we have about a little over 140 cases here within Ohio. When we started convening for monkeypox about 5 weeks ago, I think there were 3 or 4 cases in Ohio. So yeah, that's kind of the progression that we've seen. And for a while it was doubling. It's not doubling anymore. We've seen that slow down just a little bit. Hamilton County has 8 cases. Butler County has 2. All of this is out on that public public dashboard that folks can take a look at. The majority of the cases we're seeing are in the Columbus area by county. But then when you look in the Cleveland area, there's actually a little more broader geographic spread than what we're seeing down here in Southwest Ohio.
And someone just asked where in Ohio. I think you answered that. And in Hamilton County, you said there are eight cases known right now.
Correct, and 2 in Butler County, but to our counties, directly to the east, I don't believe there's any cases identified according to the website.
Well, 8 doesn't sound bad. I mean, right? I mean, that doesn't seem anything that it doesn't seem like a large enough number to start panicking over. Not that we want people to panic, ever, but 8 cases doesn't worry me that much. I mean, right? I mean, am I wrong not to be worried about it?
I think it's good to be cautious about it because we've seen 2 or 3 cases turn into 163. That being said, we have our vaccine out there, and we've given, a fair number of a couple hundred doses, very approximately. I sort of back of the napkin calculated that. I should have looked up exactly how many, but I think it's almost 200 that we've given.
So maybe we're on top of it. I mean, as opposed to COVID, they kind of got ahead of us. Maybe with monkeypox it sounds like we've got enough vaccine for now, right? And the cases, 8 isn't horrible. It sounds like we're getting it under control. Is that right?
Hopefully.
Okay.
Yeah, I think the goal is to, I think really the goal here is around awareness and education. Clearly, the goal is not to panic, but the more education we can get out there, the better. The universities are all going back in session, a lot of large congregate living areas, there's watching for COVID and now watching for monkeypox as well. And so creating that additional level of education and awareness with the students and the staff at the university level is incredibly important, and just continuing to keep that awareness and conversations going, in all aspects of life at home and out in the community and within our schools is very important.
I think OU actually just they will be starting school, and they've put in force, a mask mandate because they're a high spread level at this point in time. So that's the only one I know, though.
Okay, then here's another question. Let's see, it says, I'll check the chart later, but just curious, with the cases that are known, what if any are the commonalities in the individuals? And I don't know if we're just talking about those 8 in Hamilton County or just generally.
Oh, that's a good question.
That's a great question. I can see if I can find the data again. I'm just recalling offhand, I think 96% male, ages between like 19 and 60 something. So don't quote me on that. It's on the website. I'm reaching back into some sort of visual memory here, but that's what I recall seeing on the website. And I'll try to pull that up.
But but Tiffany, we should point out too, that because they're asking here about minors, have any minors, but minors cannot, all ages can get monkeypox, isn't that correct?
Mm-hmm. That is correct. Yes. And
go ahead.
Yeah, I believe so. I don't know how many children with monkeypox there are in the United States now, but about 4 or 5 days ago, there were 5 known cases. So children can definitely get monkeypox, and they certainly have in previous outbreaks.
Yeah. The other, I think I'm on. Oh no, I'm not on mute. I'm sorry. I was on mute. The other a data point that they have is around hospitalizations in the number of counties. So looks like there have been 9 hospitalizations, or about 6%. In my readings, and the other 2 experts on the phone or on the line can weigh in as well, but mainly that's due to either IV hydration and pain control. So if you have lesions in your mouth, it's very painful to swallow. So to get some IV nutrition and hydration, as well as some pain control, is usually the reason for hospitalization.
Another question says, you mentioned previous outbreaks. What helped or was the remedy in those previous outbreaks?
So I haven't studied in depth those previous outbreaks, but essentially they were small numbers of cases, and the virus eventually burned itself out through, identifying cases and isolating folks who were affected, and also identifying the vector. So in the past, it's been I think the 2003 outbreak was associated with rodents. I don't know what rodents, or if they were pets or what, but that was likely part of the solution. But also the vulnerability of the population has changed over time, because the smallpox vaccine presumably has some protective effect, but we stopped giving smallpox vaccine in the United States some time ago.
Oh, right. So children don't get that anymore. Should we start that back up?
Well, there's no smallpox, and it's kind of a nasty needle. It looks like a science fiction torture device. I mean,
I had mine in Africa when I was a kid, and boy, yes, it leaves a scar as well.
Oh,
Yeah.
really? Okay.
Okay, we don't have to have it if we don't have to have it.
But that's
Yeah.
if it's not
Good advice.
if it's not
The
necessary.
Jynneos vaccine is much nicer. Whether or
I
not
was
that
going to ask
becomes,
you, hopefully the monkeypox vaccine is not like you're describing for smallpox, right?
yeah, no, not at all. This is much more typical. So, and the Jynneos vaccine is actually a smallpox vaccine as well. So it's smallpox and monkeypox.
Vice
Yeah, we
Mayor,
don't want to scare people, right? Tropikana, because
Yeah.
we went through this with a lot of people who didn't want to get vaccinated because they were afraid of needles, and that was actually a lot of folks. So
Yeah.
yeah, so we don't want people to be afraid of this. It's not that bad, right?
And I think it's also not a shot that goes into your muscle, the way the COVID
Right.
vaccine went deep down into the muscle, and you could have some really significant arm pain with that for a few days, or muscle pain. This one doesn't go that deep, so it just goes into kind of the fat layer under your skin.
So when will we know when it's time to line up to get, if we're not in a high risk group, how will we know when it's time to line up to get the monkeypox vaccination?
That's a
Dr. Mussman,
great
that's a
question.
for you.
It's gonna be a judgment call of some point. When are expert epidemiologists going to say, hey, this is endemic, and this the virologists and the vaccine experts carefully weighing, at this point, the any risk associated with the vaccine, even though we know it's a very well tolerated vaccine, and most of the risks are local, and there don't appear to be systemic reactions. And by the way, I looked at the package insert, and there's not really enough data to know about pregnant women, but there's nothing that so far it takes a lot of data to prove a negative.
Yeah.
So there's nothing to suggest that there's a problem there. But I think there's going to be a lot of factors that have to go into, what bridges are we burning by recommending another vaccine? Like that's, is it worth it from a societal standpoint for our other, they just had a polio case in New York. Like, Is it worth it for vaccine buy-in? Are we going to start getting polio because people are just going to be done? So it's going to
Well,
be
I
a
thought
complicated
polio was
decision.
over. So yeah, I
Yeah.
was surprised about that. I thought we were done with polio.
What's
So,
interesting is after COVID, I just kind of wonder, as a society, are we just hyper aware and sensitive to virus information and wanting to be healthy? Or is this a common conversation that you all see in the medical community? None of us were medical experts prior to COVID. Nobody was an expert on social media or a doctor until COVID broke out. So is this just a conversation that, as medical experts, you see often? There's always a virus outbreak, or is this new and a new normal for,
I think
I guess,
I think just with the impact of COVID being as wide and as deep as it was, and the polarization from the political standpoint, I think there were a lot of things that made this unique as compared to other viruses that have been out there. We've had other coronavirus outbreaks previous that, were sort of a blip on, the screen of, the conscious of the normal population. This one was very unique. I mean, there were things like just even, the term Operation Warp Speed and mistrust and a bunch of other things that came into play here that I've really not seen in the past with other ones.
So let me say this about a few questions in the Q&A. And Lisa, you want to know, and this is totally off topic, but you want to know, where can you get yellow fever vaccinations because you're thinking about traveling to Ghana. So let me just say, for vaccinations and all of that, Dr. Mussman, can they come to our Cincinnati health centers?
Not for yellow fever. So those very uncommon vaccines we don't stock because they go bad. But there are travel clinics in the city. I'd have to look who those folks are, but there are travel clinics in the city that do stock those vaccines.
So they could probably call the health department and find out where the travel clinics are.
Yeah, or they can Google.
Lisa. Yeah. Okay. All right. So Lisa, that's your answer. And then specific questions about your specific medical conditions. I see someone is asking about blood clots, from COVID, how long they should keep the filter in. I would say that's not a conversation for this panel because you need your doctor to give you information specific to you. Does anyone want to add to that? Okay. So that's not a panel. That's not a panel discussion. You want to go to your doctor and ask about you specifically. Okay. So, and Lisa, you're welcome. All right. So, I think our time is getting pretty short here. So I want to give everybody a chance to make final remarks. So let's start with Tiffany. Why don't we start with you, Ms. Mattingly?
Sure. So I am just so excited about this town hall because.
Oh, are you on? Okay.
Am I on mute? No.
You're on. No, you're good.
Okay. All right. I think we might have had like a internet just for hiccup there for a moment. So I am just really excited about this town hall because part of what we do at the Health Collaborative is a lot of communication and just trying to get the awareness and the education out there and to direct people where to go and where to find the information. So I would say that some of the last remarks are around just continuously educating yourself with the facts. Facts are important. Fact-based information is great. It helps reduce stigma and helps keep you informed and helps to keep you safe. So I think that's one little nugget I'd love to leave with folks today. And the other one is to stay up to date with your vaccines. You can always follow the mask guidance from CDC, but you can always wear a mask on your own as well. And so to just assess your own risk level and the risk level of those around you is incredibly important. And stay home if you're sick. And when in doubt, test.
All right.
I'll leave it at that.
All right. Dr. Mussman.
Sure. Thanks for having me on this panel. I really like the opportunity to get in front of the public. Tropikana, you had me on one thing, I think about a year or so ago, and it's always a pleasure. one thing I would say is it's very natural to have questions and doubts about some of the things, and it's okay. And your primary care doctor is a great resource when you do have questions, or you read something on Facebook that doesn't sound right, or there's a lot of misinformation out there, and it's hard to know exactly what to do with everything that gets thrown at you. And I would encourage that relationship as a really good one.
Okay, thank you so much. All right, Dr. Edje.
So I want to make a plug for preventive care, which vaccines are a subcomponent of that. And the foundation of great preventive care is an excellent patient-physician relationship. So if you do not have a primary care physician who you're very comfortable speaking with, asking questions about anything, you need to go ahead and get a primary care physician. Having a primary care doctor prolongs your life. That's an indisputable fact. So
thank you guys for joining this panel. As always, we just appreciate your service to the community, your dedication to medicine, and making sure that we are all healthy, keeping our health top of mind. You are so appreciated. As we are turning over to our leader, the CEO of the Center for Closing the Health Gap, Ms. Renee Mahaffey Harris. You know I have to say it like that. We have
anyway.
Can you answer this question from a student as you were closing? They want to know, and you can answer this because you are the expert on this. If they need a primary care physician, who can they go to, or where can they find a new primary care physician? Thank you.
Well, I will answer that question. They can call us at 513-585-9879. And we work very closely with the Cincinnati Medical Association, and we will definitely assist them in providing them a list and directing them to Black physicians if that's who they're looking for, or if we need other information, we will provide that direction to them.
And don't forget the city's health.
Oh, I'm sorry. And the city health clinics, we have 6 clinics in the city of Cincinnati. I don't know your phone number, but Grant, if you want to, Dr. Mussman, if you'd like to share the phone number.
So it's, I think it's 3. You know what? I don't know it off the top of my head.
Well, I tell you what, they can call our office and we will direct you to the Cincinnati Health Department clinics.
And that's also for dental care. Let me just make sure people know
Yes.
it's also for you. Some of the best dentists in the city are right there at the Cincinnati Health Department.
We've got some excellent, we've got women's health, we've got family medicine, we've got pediatrics, internal medicine, some great dentists. We have eye care. We have pharmacies. And behavioral health. So, yeah.
So we have resources, but please, feel free to call us at 513-585-9879. I want to close by thanking all of the panelists. I'm so happy for the collaboration we have with the Health Collaborative, with the Cincinnati Health Departments, and Dr. Edje, who is just phenomenal, a member of our board as well, and just a phenomenal leader in our community. And I want to thank our moderators, Vice Mayor Kearney and our very own Tropikana. And again, we must continue to work together to save us. Information is key, and if you have a question, ask for answers, and keep asking and keep protecting and keep giving each other grace. So have a blessed day. Thank you for being here.
We're 513-357-7320.
All right.
Got it. Thank you all.
Thank you to our nursing director.
Thank you. Thank you, everybody.
Thanks, everybody.
Bye.
Thanks.
Thank you.